Okay, so welcome everyone. Thanks for joining us today. This is our second episode of the Personalised Care vlog. Joining us on the call today, Joe McGoldrick and Katie, who'll be introducing themselves very shortly. Before I do introduce, I want to give a bit of context as to why we're having a catch up today. That's to probably unpick a little bit more around properly supervising and supporting link workers or anyone who supports patients in primary care, but also people whilst in their community around social prescribing roles. There's two key questions we want to cover. Before we go into that, I'll let everyone introduce themselves. Katie, do you want to introduce yourself?
Yeah, I'm Katie Dealey. I'm the Communities and Partnerships Manager for Sandwell Council Public Health.
Welcome, Katie. Joe?
Hi, I'm a health coach in a GP surgery part-time, and I'm also working for NHS England as a supported self-management mentor.
Excellent. So before I go on to the first question, a bit of context. There was a study of this year that I think was commissioned by the National Association of Link Workers, which had really helpful key messages about the progress we've made in terms of supporting link workers since the funding came out from the Primary Care Network Days last July, I think that was. It looked at a whole host of other issues as well, including to what extent we can assure ourselves that link workers are really well supported. And in actual fact, in some cases, it was found that some of those link workers are considering whether or not they want to stay in that field. I can't remember the statistics. I think it's about 1 in 5 are seriously considering whether or not they want to carry on and committed to that role, which is worrying to hear. To be fair, we don't know to what extent that applies in Sandwell. I suppose to what extent that applies in the other parts of the Black Country and West Birmingham footprint as well. I'd hope that would be the case. But what it has done is it's prompted me to think, right, well, maybe it would be a good idea to unpick this a little bit more and think about it in the context of our own population, and to share those key thoughts with others in the system that are either thinking of recruiting link workers, and they're thinking, you know what, quite tricky, it's a new role, I'm not quite sure how best to support my link workers. So the first question we've got then is around, what are the barriers do we think are to effective support and supervision for link workers? What I'd say, what are the barriers? I'll open it up. Don't mind who goes first.
I mean, I suppose kind of recently we've started having kind of monthly meetings with some of the PCN link workers in Sandwell to try and understand what their kind of concerns are, I suppose, with their patient lists. And I think some of the barriers tends to be a bit of isolation, really, I suppose, because of where they sit. You know, kind of obviously they sit within the PCNs, but they're actually kind of outsourced and commissioned by another organisation. And I think that, you know, from their feedback, I don't think they get opportunity to kind of come together as a group, really, and kind of share their concerns and issues. You know, even our meeting, kind of, we tend to get sort of less than the recruited PCN link workers. You know, not everyone's able to make the meetings, but it is a good opportunity to kind of talk about some of those issues. So yeah, I think, you know, kind of isolation could be a barrier to some of the and the way that it is.
Okay. Joe, any thoughts?
Well, I was kind of thinking the usual thing about, you know, cost and the funding of things, and that boil always kind of raises its head. People are, I think, really hungry to continuously learn and to be supported in that learning. But then there's always this, what's the cost of the training? Then there's a limited size number. So if people aren't quick enough to book on, they can't get on. And I just think that, you know, if we can find you know, low cost or free training, even, you know, the e-learning, and just signposting people to that is something that we should always be considering, and looking for, as a minimum, e-learning options. I know people sort of tend to prefer, obviously, something a bit more real, but as a bare minimum, can we find options that are out there that are less costly and then fit into schedules easily, so we don't have to, we can't make it because of a planning issue. So that would be really important to try and consider as well, I think.
Okay. I suppose partly the second part of question one, do you feel there is any evidence whereby in GP practices, because the role is quite new and because it's not a clinical role, it's very much about the person having a lot of community-based experience, do you feel there's evidence that practices might be out of their comfort zone in terms of how they go about supporting link workers, because it's something that's not quite, is that something that's quite evident, do you think?
Is that to me? Sorry, Terence, I'm not sure.
Well, but if you say Joe firstly, I suppose in your experience, yeah.
Yeah, I think so. I think all of the new roles that are coming out are new in principle, and it's you're talking to GPs or clinical directors who are caught up perhaps with their head in another space at the moment, and yet also at the same time having to very quickly work out who this person is, where they sit, how they interact within the team, how do we promote it within the GP surgery, the PCN, wider field. I think those are very real concerns to professionals that are already under pressure, thinking about the latest emails and policies and procedures that they have to consider in terms of health and safety as well. So there's a lot going on.
Okay. I suppose, Katie, as well, building on your initial response around making sure people are able to overcome their isolation. I mean, that's become very profound during the COVID outbreak, especially. People are doing a lot of work from home. All the advice is around not coming into work, about staying at home and staying safe, and that's probably exacerbated that's the situation, I imagine. What are the kind of practical measures you think could be put in place to ensure that if a GP practice is recruiting someone, that they are plugged into things that are happening at a neighbourhood level, so they can try and manage that isolation?
Yeah, I think it's important, I suppose, for the link worker to understand and know what's in and around their patch. And I think sometimes the kind of the PCN or the GP surgery that they may be based at, that's not, like you say, it's not their area of expertise in terms of understanding the community activity. That's kind of the role of the link worker. And I think, it's going to be quite difficult. And I think it is quite difficult because the footprints tend to be a little bit, kind of how the PCNs are, kind of how they're structured, and sometimes that can be quite challenging because, I know a couple of the link workers might have patients in a surgery in Wednesbury, but they might have patients in a surgery in Rowley as well. So I think that it's quite difficult if you're trying to get to understand that area. Like I say, we've got public health development officers that cover one town, and there are a lot of kind of activities, sort of anchor institutions, organisations that they need to kind of make contact with and get their heads around. So I think that to overcome that, it's about kind of not making sort of, I suppose, new links in terms of that. And I suppose it's going to the places where that you're going to be able to get the information. And I suppose that's something that public health can bring to the table in terms of they are the on-the-ground link in that setting space, so they have contacts and information in the voluntary sector. They have contacts and links with local primary schools. They know their areas and their patches. So I suppose it's not reinventing the wheel and kind of trying to connect the link workers through sort of kind of the mechanisms that are already in place, really. So yeah, I think that can be something that we can really support with, I guess.
Brilliant. As I imagine would be the case with other public health departments in the other local authorities as well, across, say, Walsall and Wolverhampton. I imagine that the same, there'll be similar functions. I mean, the teams would be slightly differently set up, but
yeah,
the principles would be the same, wouldn't I imagine?
Yeah, and it might not be that it's public health that's best placed to do that. It might be kind of other departments within the local authority, but public health again can kind of sort of kind of open those doors, I guess. And I know from our own kind of communities department, You know, they've been introduced to the link workers as well, so they're a key kind of support for the link workers around some of the organisations that can help their patients.
Okay. Cool. So we come on to our next question then. Now, building on that, that's around what does excellent supervision look like for the link workers? So I suppose the context of that is that, as was already alluded to, we've got a situation where some of our link workers are recruited through external contractors that are attached to specialist agencies who specialise in providing social prescribing services or something like that, and they'll have access to specialised support and supervision. So I think we're cognizant of that, and we're also cognizant of the need for if you've got a primary care network who's recruited someone, you still need to have a kind of assurance that that link worker is being supervised. And I suppose as well, it's us being aware of if those specialist agencies are specialists because of that, it's because of knowing why is that? What is it? What does very good, excellent levels of supervision and support look like for those link workers? To ensure that primary care networks are supporting their link workers in the best possible way, and that they're not isolated. So, what are the key ingredients of making sure that we supervise our link workers really well? I'm going to go to Jo first. You can talk about maybe your coaching context as well, especially from a coaching context.
Well, I can throw a few hats into the ring straight away, but that is isn't that a massive question really, and one that, you know, whichever sort of role we're looking at, that's what we want. We want excellent supervision or training for whomever we invite new into roles, and especially at this time, and especially if it's a role that's new and not really understood, because then the support is so much more important. So some things immediately that I would be thinking is that, you know, consistency. We've got to have a consistent approach towards the supervision and the training. It shouldn't be that some people get it better than others just because of where they live or their certain PCN. So, you know, we should strive, I think, for consistency. We should strive as well to give people the opportunity to be able to be supervised properly as well, not where they find that they haven't got the time to do it, or meetings are cancelled, or, you know, anything like that. So we've got to make it as accessible to people as possible. It should be timely as well, obviously. So maybe they need more at the beginning, or, you know, and that may as well, we talk about personalised care, maybe it should be personalised towards individuals as well, where we are able to pick up, you know, problems and issues with certain individuals and carry them a bit better at the beginning or towards the end or after a certain event. So I think, you know, it's really important that we do personalise our approach to everybody and everything, not just the patients that we see. I could go on a bit more, but Katie, I'll give you a chance to jump in with some as well.
Yeah, no, I think you're right. I think consistency is key, isn't it, in terms of kind of making sure that everybody gets that support that they need and that it's equitable, no matter where, sort of which PCN you sit in or which organisation you're employed by. And that is kind of, like you say, it's one of the biggest challenges, because, you know, there are a lot of players in and amongst things, and I do think as well, sometimes I suppose some of the things that to flip it on its head, I guess, in terms of kind of ensuring that the GPs, the clinicians, that the PCNs are aware of what the role is and kind of what it's for in its kind of in the most detail, I suppose. Some of the challenges that, you know, that's fed back through some of the meetings that we've had with the link workers is that sometimes they get referred inappropriate people, and that then puts some pressure on the link worker, because it's something that they feel they don't have the skills or, you know, the knowledge to be able to deal with. You know, and they're trying their best, you know, but some of it is kind of out of their sort of realm, I suppose. So I guess that's something in terms of, like you said, you know, that personal support and kind of GPs and whoever's the source of the referral, understanding and knowing what their role is and what their expertise is, so that they don't kind of, you know, refer inappropriate patients and put pressure on the link worker, which I think is going to be a challenge, because there are going to be more and more people who need sort of different levels of support. There's lots of complex cases that come forward, and it's multiple issues, which I think the link worker is great to kind of deal with, but some pieces of that might not be as appropriate. So I think training and sort of knowledge for the referrers as well, I guess.
And I think picking up from that, you're right. So the supervisor would need to have real knowledge and experience of the role and what isn't appropriate. So when they are supervising somebody, they're very quick to say, that is out of the boundaries of this role, that is out of the remit, and giving then, social supplement link worker the confidence to say, actually, no, I'm not going to do that again. I know better next time. So having, that support network who actually knows the job. They're not just bought in because they look good on paper. They get it, and I think that's really, really important to have that trust and respect with whoever provides the training and support as well.
Excellent. Okay, so we're run out of time for today. I think what I'm going to suggest going forwards is that we are going to carry on doing these sessions. If our colleagues like them, we'll carry on doing them. I hope they like them. It looks like we've had a really good response from the first one. I hope the second one goes really well as well. I want to thank you, Joe and Katie, for your time. I think there's probably quite a lot more to discuss as well. It's quite difficult to try and capture this in such a short period of time. So what I'm going to do in the comments of this video, I'm going to include some links to some useful resources that are available either regionally through the regional link worker support. I think it's Dudley CVS right now. And any national evidence as well that's linked to, and we can just keep adding to that learning pool as well. Explore what we need to do in the third video as well, and we'll open it up for discussion. I think the whole point of these is to try and spark off discussion across the system. That's what I'm hoping that this will do. But thank you so much for your time. Cheers, guys. Thank you.
Thank you.
Thanks, Terence.